This video will provide an overview of the Traditional BSN program. It is a 5-semester full-time program that runs during the fall and winter. The program is based on Grand Valley's Health Campus, where you'll move through a carefully structured sequence of classroom learning, lab experiences, simulations, and clinical rotations. One of the most important things to understand is that the nursing program requires flexibility. Your weekly schedule will look different from one to the next, and that is completely normal. Many of our courses are delivered in hybrid formats or as part of term courses, meaning that some run for a shorter duration, like 7 weeks, while others span the full semester. Each year, you'll receive registration instructions and course assignments. These assignments are based on your clinical placements, which means they cannot be changed once they are finalized. When you log into Banner to register, you will notice placeholders for both your clinical and your simulation courses. These placeholders may list a day of the week and sometimes a general time frame, but keep in mind that when you're looking at Banner, you will not have all of the information. This is because clinical placements and simulation schedules are shared separately from course registration. Clinicals can be scheduled anywhere within Kent, Ottawa, and Muskegon counties. They may occur on weekdays, evenings, or weekends, depending on site availability. Students are responsible for their own transportation to all classes and clinical experiences. There are no planned absences for clinical or lab. Attendance is required in order to progress in the program. As you move forward, each semester will have its own population of focus in a slightly different structure. You can expect your lectures to be around 60 students, labs about 24, clinical groups of 8, in your very final semester of the program, you'll do a one-on-one immersion with a preceptor. Semester 1 is a focus on foundations of nursing and long-term care. You'll begin developing essential skills while completing clinical nutrition and pathophysiology, connecting your science concepts to patient care. In the second semester, you'll focus on adult nursing, gaining experience in hospital medical surgical settings. You'll also take pharmacology and community and public health nursing, building a confidence in medication management and patient care. Semester 3 introduces a split focus. In half of the semester, you'll focus on obstetrics, and then in the other half of the semester, you'll do pediatrics. You'll rotate through these areas while completing your nursing research and human genetics. Semester 4 also splits into 2 separate parts of terms, where one half is psychiatric mental health and the other is adult nursing. You'll also complete your supplemental writing skills requirement and an interprofessional education course. This semester, you may also add in a nursing elective, general education, or honors course. The final semester focuses on leadership and community practice. You'll complete a 160-hour clinical immersion with a preceptor and apply your skills as you transition into professional nursing practice. This semester, you'll have another opportunity to take an optional nursing elective or a general education or honors course. It's important to continue meeting with your advisor throughout the program. Advisors can help you plan your general education and honors requirements. It's important to recognize that only semesters 4 and 5 of the program can typically fit a 3-credit course without exceeding the block rate for tuition. KCON has also been exploring new summer study abroad opportunities, so stay on the lookout for more details. Semester 1. This is a 13-credit semester. During this semester, you'll have nutrition and pathophysiology, which must be taken either during the semester or prior to your first semester of the program. If you've already completed nutrition and patho, we recommend replacing it with an online asynchronous general education or honors class that fits your degree plan. Nursing 222 is your Foundations of Nursing Theory. There are 2 sections, Wednesday morning and Thursday morning. You'll be assigned to one section based on your lab group. One part of Nursing 223 is your lab course. You'll be assigned one lab section that meets 2 days per week for 3 hours a day. In lab, you'll develop your foundational nursing skills, learning how to take vital signs, perform a physical assessment, and assist patients with mobility aids. The second part of Nursing 223 is your clinical. You'll complete one clinical rotation every other Tuesday, lasting about 7 hours a day. Your first Tuesday of the semester will be an orientation day, so you won't start clinicals week 1. The clinical focus for this course is within a long-term care facility. Clinical placements will be shared separately from course registration. Lastly, simulation sessions are scheduled on Tuesdays, alternating with your clinical day. You'll be assigned a 3-hour time slot, typically between 9 and 4 p.m., but your exact schedule will be shared closer to the start of the semester. These sessions focus on applying your skills in a controlled setting through health history practice, cultural simulations, and focused assessment rounds. Once you receive your registration instructions, you're welcome to begin adding your assigned courses to your schedule in Banner. If you run into any registration errors, please contact Mackenzie Ware by email. It is very helpful if you can include a screenshot of the error, your gene number, and then a note about which program you're in. For broader questions about the program or your degree plan, don't hesitate to schedule an advising appointment through Navigate.